Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Today, we're going to be talking about blood tests and the blood tests that you might get at a physical, as well as blood tests that are good for monitoring patients with COVID-19. The COVID statistics of the US for today are as follows. As of August 27th, the CDC reports that there are 5.8 million cases of COVID-19 in the United States, and there was 180,000 deaths. The numbers, of course, are always increasing. However, they are not accelerating as fast as they were a couple months ago, or rather, like a month or a couple weeks ago. So that's good, but we cannot lift our diligence at preventing the spread. Let's welcome Dr. Sherman to the show. Hello, how are you?
Nice to see you again. Thank you very much.
All right, so the blood tests have been something that I personally actually have been always interested in, but I actually never got around to learning about it or asking doctors that much about it. So let's start with a blood test that everyone has probably done in their life, the blood test that you get at a physical. So what do they like to monitor at a physical?
You go to your internal medicine doctor every year. You get your checkup, your annual checkup. They're going to draw blood. They're going to draw several things depending on how old you are, but I'm just going to go your typical adult checkup. They're going to check a complete blood count or a CBC. They're going to check a complete metabolic panel or a CMP, and he or she will probably check a thyroid panel to check your thyroid function. They might check vitamin levels, like vitamin D levels, and he or she would also check your cholesterol levels. Those your standard things, and also depending on the patient, they would maybe probably check your iron levels, as we've discussed in previous shows. Vitamin D and iron in patients who are maybe low on those. These are just general tests that we would get at a physical exam, even if you're, totally healthy.
Okay. All right, so that's nice. It seems that a physical blood test will test some vitamins, some crucial vitamins, some crucial markers for other chronic diseases like cholesterol. And what is CBC?
Yeah, so the CBC, complete blood count, calculates your white blood cells, your red blood cells, and your platelets. So we can take those one at a time. The white blood cells are infection fighting cells that are, you always have a certain amount in your bloodstream. If you're healthy, you've got, between five and 10. Let's just use that range, 5 and 10. The units we can discuss another day, but you want to discuss the range of 5 and 10. Most everybody lands between in the white blood cell count. If you're sick with a flu, or you're sick with a appendicitis, or you're sick with any infection, pneumonia, your white blood cell count will probably be higher than 10, 11, 15, 17, because you need those cells to fight off whatever infection you're having. So that's elevated in the time of infection. But on a well checkup, they're going to check for that, because those cells can go high in other conditions, like a chronic leukemia or something, where they may be 35 to 45,000.
Whoa.
And unless you check it, you wouldn't know. But most of the time, it's for healthy people, you're between 5 and 10. The red blood cell count, or a hemoglobin, is checking your red blood cells, how much oxygen carrying capacity you have in your blood. The red blood cells is what oxygen attaches to and helps get oxygen delivered to the tissue. And you want to have a good amount of healthy red blood cells, or a good hemoglobin. And we're checking the hemoglobin to make sure you're not losing red blood cells somewhere with a GI bleed or internal bleeding somewhere. So the red blood cell is is helpful there. And then part of that CBC is the platelet count. Platelets are little cells to help clot blood that can be low in certain conditions or high in certain inflammatory conditions. And you want your platelets to land between 150 and 450,000. And so you just monitor that. There are conditions where there are low platelets. There are conditions where platelets are elevated, usually more inflammatory conditions. Elevated platelet count's a poor man's elevated white blood cell count.
I see.
But you're looking for low platelets, and those would be a red flag for something going on in the bone marrow, or like another chronic leukemia type thing. Very rare to find that, but it's part of the complete blood count.
That's very interesting. One thing that I thought about here is that I know that hemoglobin uses iron, and your red blood cells use hemoglobin, so they use iron. When you get a physical and you test for iron, are you testing for hemoglobin iron overall?
Yeah, all of it. Yeah, iron overall. If your hemoglobin uses your iron stores to make the red blood cells. If your red blood cells are low, your bone marrow is going to be programmed to produce more red blood cells quicker to make up for the lack of the ones circulating. So you're going to use up iron, and you're going to use up ferritin is another iron type of test. So if you see a low hemoglobin, you get an iron, and you might see low. You'll probably see low iron because your bone marrow has been manufacturing, trying to keep up with the blood loss and manufacturing all these red blood cells and using up your iron stores. And as a result, you're going to need to take some iron to make up for that and help replace the low hemoglobin. But what will be the answer ultimately, and this is not a blood test topic necessarily, but is to find out why you are losing hemoglobin, internal bleeding, for example, and whatever. I mean, why do you need all that iron? Why are your blood cells being destroyed or losing them so quickly? That putting a stop to the blood loss is going to, help your iron regain its normal levels over time.
So from a loss of red blood cells, your body's going to need more iron to make more red blood cells to replace the ones that were lost.
Yeah.
How much? Because we bleed whenever our skin is cut. Whenever our body is cut somewhere, we tend to bleed. And I'm wondering how much bleeding you really need to have to change your diet in some way to have more irons. So, like, is there a point where if somebody gets some kind of external wound, should they take like an iron supplement to temporarily boost their iron stores?
Yeah, I mean, you would take the iron supplement if you see the hemoglobin and iron levels trending down. Okay. Or maybe if the hemoglobin is not that low, they can just take the iron on its own and watch the iron come back. I mean, if you're losing iron, if you're using iron to try to generate the hemoglobin, you're going to eventually run out. I mean, sometimes the bone marrow can keep up ever so long. So supporting it with iron stores, iron supplements is going to be very helpful in sustaining it. The question is, why are you losing blood cells? Or two, were you not getting enough iron in the diet to begin with, or are you not absorbing the iron? In which case, you need IV iron. So there's a big workup on how to look into all that. The bottom line is, you need you need to know why you're losing iron. Usually, it's like I said, an internal bleeding thing. You got to go looking in the colon and the stomach and the small intestine, looking for things. Some people just don't make a lot of iron and don't absorb it and just can't put it to use, and their bone marrow is getting pooped out. We call that anemia of chronic disease. They just don't manufacture enough, and so you got to just supplement it with iron supplements. You got to be careful about iron supplements. It's constipating. It can bother the stomach, so you don't want to overdo it and turn your insides to cement and be adverse to taking iron for the long haul. You got to do it smartly, take it gradually. And then there are just some patients who just can't tolerate oral iron and would need IV infusions at a
Right.
infusion center.
What I was curious about is if someone, isn't, this is not blood test scenario. What if somebody gets like a cut that doesn't warrant them going to the hospital? Would they ever really need to take an iron supplement like once to make up for that blood loss? Like they
No,
scraped.
that blood loss is
Yeah.
insignificant in terms of iron replacement or iron need. So that
Okay.
blood loss is not the acute blood loss is not going to do it. Whether it be a cut, a gunshot wound, whatever is going to cause you to lose a lot of blood at once. You don't need iron for that, because your system will make up for the blood loss there, because you will have been able to stop it eventually, and then your system has enough iron to replace. And it does take some time though to get your blood count back. If you bleed and your hemoglobin goes from 15 down to 12, it's going to take about 2.5, 3 months to get it back to 15.
Wow, that long.
Yeah, blood cells, die off naturally. So
That's
you're
true.
replaced. So that you have to overcome that, and you just got to make up for the lost blood by churning out extra blood cells. So it takes about 120 days to get back to baseline.
And I guess that's the importance of having blood donations, right? Having blood bags.
Yeah. Now that's if you've lost more than that.
Okay.
You have a gunshot wound, your hemoglobin can go from 15 to 7, and then you need blood right away. And iron's not going to help there. You need an actual unit of blood to get, in that acute setting to get your hemoglobin up. Each unit of blood that you're transfused is about 1.5 hemoglobin points. So if you get one bag of red cells, you go from 7 to 8.5, another bag up to 10, and so on. And you want to get eventually, you want to just get to there with the blood, and then let iron take it from there.
We have 2 questions from the chat about blood tests and iron. One person asked, when is the best time to take an iron supplement? And another person asked, if you are bruising for no reason, is there a test that you can say why you have bruising everywhere?
Excellent questions. The iron supplements, because they can bother the stomach, best taken after a meal. Usually, though, I would take it after breakfast. I would recommend taking it after breakfast for a week, once a day. If you're doing okay, add the lunchtime dose and take it after lunch for twice a day for about a week or 2. And if your iron is low enough and you need it 3 times a day, you can add the nighttime dose after another week or 2. So after about 4 or 6 weeks, you're up to the 3 times a day dose if you need that much. You can always increase the dose a little bit slower, but it's good to get that 100 milligrams of elemental iron at least once a day after each meal. In terms of the easy bruising, you want to look into your platelets as part of the CBC to make sure they're normal. Your platelets probably, your platelets may be low, but there's also other blood clotting tests called a ProTime or a PT or a prothrombin time, a PTT.
Okay.
Those are blood clotting tests that are separate than the platelets. The blood clotting cascade has several different arms to it, platelets, and also blood clotting factors, as we call them. Platelets are produced in the bone marrow to help clot blood, and blood clotting factors are produced in the liver. And the ProTime is a measure of several blood clotting factors, including the vitamin K related clotting factors. And if your ProTime is off, that may mean your liver is off and you're not making enough vitamin K to help make those clotting factors. So the ProTime is a test, and a prothrombin time, another part of the blood clotting factor cascade, is something to look into. The ProTime, the vitamin K, those are the liver producing clotting factors. In alcoholic patients who have liver disease, though, that ProTime is out of whack, and that is a window into seeing how severe a patient's liver disease is.
Okay, I think that was pretty
A little bit of a
satisfactory.
long-worded answer, maybe, for a simple question. I apologize for that.
That's okay. So basically, if you have bruising for seemingly no reason or very easy to bruise, then you should ask a doctor about that.
Yeah, look into your proton and platelets, but part of it may be the local vessels. They're weak-walled. Usually, in older folks, the smaller vessels are more brittle, and it doesn't take much to break those. And it may not be a clotting thing, more just a weak vessel that if you bang into something, or it doesn't have to be even that hard of a bang, or even sometimes those vessels kind of break spontaneously. You're going to see a little bit of a bruise in there. But if in a young person, if you've got bruises for some reason, or you brush your teeth and your gums bleed, and why would that happen in a young person? Or you cut yourself shaving and it bleeds on and on. Look into these blood clotting factors with a ProTime and check your platelets out.
All right, thank you. That was pretty good.
Yeah.
All right, so that was a nice little discussion about blood, I suppose.
Yeah, then we talked about the CMP, the complete metabolic panel blood test.
Yes, the metabolic
earlier,
panel.
which monitors your kidneys and your liver primarily. It checks sodium and potassium, which are monitored and regulated by your kidney. So that's a good window of how well your kidney is functioning. It also looks into chloride and carbon dioxide, other measurements of your lungs and kidney. Those are not the most important elements of the metabolic panel, but they are included. They look for something called the BUN, or it includes something called the BUN, blood urea nitrogen, how much nitrogen is in your blood, and creatinine, which are kidney function tests. Those are the two most important kidney function tests. Normal BUN and creatinine mean you have normal kidney function. And calcium is part of that blood count, metabolic panel, your calcium level. We talked about vitamin D and calcium, and then we have to make sure that's in the right range, because too much calcium can lead to systemic side effects and some neurological side effects and some trouble with your body. So we want to make sure your calcium levels are normal. And then finally, part of that is the glucose, or your sugar levels in your blood, to see if there's any diabetes or signs of diabetes. That's the front part of the metabolic panel.
That's really quite nice, because that you mentioned diabetes, because it just so happens that the person asked, would bruising have anything to do with diabetes?
Probably not. Probably not. Diabetes deals with other complications, trouble with your feet, trouble with circulation, not necessarily bruising, but just poor circulation. Blood flow is not so great. It doesn't really cause rupture uh, or bruising, but it's just poor circulation, especially the extremities and your feet. It just the vessels just start to calcify, and just the blood just has a tough time reaching those areas. So poor circulation, some eye trouble, some retina problems, some nausea and vomiting, and poor stomach emptying, and just an overall, it's kind of like aging a little bit too prematurely. The diabetes. That's why it's important to check the glucose every day, and that's just part of and that's a doctor's office visit. That's not part of what diabetics do. Diabetics at home check their blood sugar every day with a little finger poke, in their finger. Doctors are going to just look in your general
Right.
to see how you're metabolizing sugar as a window to see if you're having signs of diabetes. But those other complications are the main ones. The poor circulation being the thing we got to make sure, so you don't get ulcers and skin breakdown and infections on that, which are very difficult to treat.
All right, so the metabolic rate has to do with kidneys, and you mentioned nitrogen, and that has to do with urea, I believe.
Yeah, urea, nitrogen. It's like how, in our gas exchange, we're breathing in and out nitrogen, and the kidney then cleans our blood. And if the kidney's doing a good job of cleaning our blood, it's going to eliminate a lot of the nitrogen in our blood. So you're going to see the urea nitrogen level a certain baseline low level. If our kidneys are having trouble metabolizing our blood and are impaired, that urea nitrogen level is going to rise. So from a normal level of 7 to 21, it's going to creep up into the mid 20s, and in bad kidney disease, it's going to be, 40, 50, 60, and that means our kidneys are not doing so well. And that's what creatinine is a sister test to urea nitrogen. Creatinine is a skeletal muscle byproduct. Our skeletal muscles produce creatinine and as a waste product from whenever we use our skeletal muscles, and our kidney then is able to clear out the creatinine in its normal function. But if the creatinine levels build up in the blood, that means the kidneys are falling behind their job and are impaired. So we use the creatinine as a kidney function test. You want to have a creatinine between 0.7 and about 1.7. Anything higher than that, you're going to start to be your kidneys are failing. That doesn't mean they don't make urine anymore. It's just falling behind, and you need to be careful on what you eat and what you can do.
Right. So is this so the let's see. Let's follow along so far. We had the blood test about the blood cells.
Yeah, we have your complete blood count saying how well your bone marrow is working and how well your circulatory cells are doing. Those are the actual cells in the bloodstream. Then there's the levels of all the other things like the sodium and the potassium and elements and the BUN and the creatinine. And then there's all those things. Then on the lower half of the complete panel is your liver, the part of that checks your liver, the what I call the liver enzymes, the AST and ALT, aspartame transaminase and alanine transaminase. Of course, you can understand why we abbreviate those AST and ALT. Those are liver enzymes, and in liver inflammation, those would be elevated. There's a bilirubin, which is part of the bile duct system. In blocked bile ducts, blocked or bad bile drainage in liver disease, that would be elevated. And then there's something called the alkaline phosphatase. This is all part of that complete metabolic panel we referenced earlier. The alkaline phosphatase is how well your bile ducts are draining, and elevated levels of an alkaline phosphatase would indicate a liver or bile duct obstruction. So we want to know if there's anything going on there. So with your gallbladder, liver, and pancreas.
All right. Definitely, this definitely has been a lot of names of vitamins and minerals and proteins that people may be unaware of. So I guess what's important is to try to take it slow and to always ask your doctor when you have questions about any of these things, just like how I'm doing with you.
Right, and I was breaking it down pretty much detailed, but as I said, the complete panel checks basically checks you for diabetes, checks you for kidney function, checks your liver function, can look into your pancreas a little bit. So it's looking at a lot of things in your body that that one little red flag can open the door to see what's going on. If all that looks good, you're good. But I went into detail on what it specifically is looking for, but it's basically looking for kidney, liver, and blood loss, diabetes, a lot of different organs that are checked on a routine checkup.
Exactly. And now that we've covered the typical physical blood test, online I was able to find that there were 5 blood tests that were good when you're monitoring a COVID-19 patient. These blood tests are called the D-dimer, the CRP, the LDH, the ferritin, and the IL-6. Or maybe ILB, actually. It's 6.
IL-6, ILP, CRP, those are all... They're broken down. Some measure inflammation and some do not. The IL-6, the CRP, and the other one. What was the? I'm sorry. The LDH. Those are signs of inflammation. Specific kinds of inflammation. I'm not going to go into too many details, but we talked about the cytokine storm in the past. So that IL-6 is part of that cytokine storm. So if you're going through a cytokine storm, that IL-6 is going to be really, really high. And your CRP, which is called a C-reactive protein, That's part of the inflammatory cascade. That's going to be really, really high. So in sick patients in the hospital, yes, you're taking their clinical picture, but you want to take maybe a look every other day at what those LDH, CRP, and IL-6 are doing. And if they're coming down, the patient's inflammatory response is starting to settle down, and that means you're turning a corner. You're just looking at the level of inflammation. So that's kind of like a blood test to see how much inflammation. You can put a numeric value to it, if you will, and that can sort of track the patient's progress and kind of see which way they're going. You don't want to see those numbers rising. You want to see them coming down. So they're best used sort of in relative to the prior study and taken as part of the whole clinical picture. The IL-6, the LDH, and the CRP, markers of inflammation. We use CRP in inflammatory bowel disease also as a marker of inflammation to see how inflamed the patient is at the moment.
So I remember you mentioned ferritin a little bit ago, and ferritin's actually one of the tests for COVID that help in monitoring COVID-19 patients. Ferritin has to do with iron, right?
Yeah, ferritin's the bone marrow stores of iron. That's like it's like the iron in the vault. You got to only use that in emergencies, and patients under stress and who need to manufacture a lot of blood cells to help to help heal themselves. Hopefully, won't dig into their ferritin stores, and you want to just monitor the ferritin levels to see how they're responding to COVID and how their recovery is coming along. You can give iron. You can't give ferritin. Ferritin you'll build up again. You'll make it back, but you got to support that ferritin level is a good indicator on how severe the patient's case is and how you can help them recover by giving some iron supplements and just supporting them more.
I actually have with me a cutout of a blood test. Well, I guess it's many blood tests. There's a lot of names here of things that we haven't gone over, and I don't expect to go over nearly all of these today. But it's kind of like a nice show of like what it looks like. Here we go. Let me get it in frame. Okay, there we go. It looks like on the right side, there's columns that have the units, but also this is the normal range, correct? Yes. This column are the numbers for a normal range of whatever the substance is that is being measured. And it looks like here are the numbers of the patient that was blood tested and measured.
Right. Yeah, so on the far left of the page is the test itself. I mentioned, sodium, potassium, BUN, creatinine. That's part of that. The result, the number, you're going to get a number for everything. The range, to kind of give you an idea, it should fall between these two numbers. And then the units, don't worry about the units, but you just want to know, are you high or low in something? And this particular patient looks fantastic, has no out of range numbers. They bold face them or would call your attention to them in some way, and this looks like it's spot on.
Yeah.
Top half is that CMP we talked about with sodium, potassium, carbon dioxide. The liver tests, as I mentioned, the bilirubin and alkaline phosphatase and AST and ALT. The CBC is below that with the white cell count, the hemoglobin, hematocrit, and the platelets. And then you get into more detail on what kind of white cells are there. Only useful if there are some abnormalities in the complete blood count. But this particular patient looks to be in perfect health and has been doing looks like can run a marathon in about an hour.
I mean, it doesn't measure your lung capacity, but in other factors, yes.
No, that's true, but, looking good.
We have a question from the chat from Angela. Is someone with anemia at higher risk for COVID? Anemia is what again? Please remind me.
Anemia is a low hemoglobin. Okay. In a way, they are because their oxygen carrying capacity, they're not at risk of getting it any more than a non-anemic patient is. So let's just leave it at that. However, if COVID hits the anemic patient, yes, they are a little bit more going to have a rougher time because they have fewer oxygen carrying cells to the lungs to help overcome the COVID. And I'm not saying transfuse, but I'm saying keep your iron levels up so you don't get anemic and prevent that from happening in the first place. Try to get as much oxygen carrying cells as you can. In older folks, that's just the way they are. They live at that number, that 12, 11 hemoglobin. And in many patients, whatever hemoglobin they are, their body has adapted. But under stress with COVID, it could mean a little more risk and a little more difficulty than in the non-anemic patient. It's all about oxygenation and gas exchange and making that virus, not play a big role, not have an impact.
Exactly. We also have a question from Angela about, can I take vitamin D for the immune system?
Vitamin D is good. It's I don't think it's helpful we know the patients have done better, have higher levels of vitamin D. Is that your immune system? I'm not sure, but we recommend to take vitamin D for better COVID outcomes, for sure. Well, like I said, will a high vitamin D patient or person have a better chance of not catching COVID than the lower vitamin D? No, but it has been documented that the COVID patients with higher level of vitamin D do better than the ones with the lower levels of vitamin D. I'm not sure it's immune system necessarily. We all know our immune system helps fight it off, but is vitamin D interacting with the immune system? It's hard to prove that. I don't know, but take the vitamin D though. We've mentioned that
exactly.
in previous shows.
I think one of the great takeaways to this episode is actually just how important a complete diet is for your health. I mean, a lot of the blood tests are related to vitamins and minerals that should be in your diet to begin with. And I guess it's very important for people to know that being full with food doesn't necessarily mean that you're healthy. You need to make sure that you're eating maybe something different every day, but also make sure you're having some kind of vegetables or fruits, because there are specific nutrients that come from that group, right, and there are also specific nutrients that come from other food groups. So it's important to just be aware and have a diverse diet.
Yeah. I mean, it may not help us for this pandemic right now, but a healthier person entering if we do preventative and healthy stuff going because we're going to be prepared, healthy, just like, heck, get away. We're healthy. Pre-existing condition patient whose lifestyle didn't give them such a health that are getting.
Exactly. Having a healthy body to begin with means that any other diseases that you come in contact with, including COVID, are going to be more easily handled by your body. This does not mean that vitamins and food are like the cure for all diseases. Not necessarily. If you do have a disease, then you better see the doctor about it. But being more healthy beforehand can make that experience easier.
Exactly. Yes, indeed.
All right. Well, I think that is a very nice place to end off our show for today. Dr. Sherman, if there's anything else that you wanted to make sure was covered.
Very good question from the chat.
Yes. Is there anything else?
Yeah, thank you. I was just going to say, it's very good questions. Very good questions were written in today.
Is there anything else that you wanted to bring up before we end off?
No, I just wanted to address one thing you mentioned. We didn't get to it. I think it's important. The D-dimer test is a byproduct of blood clotting, and as we know, in COVID there was a hypercoagulable, you can tend to make blood clots. So
That's right.
the D-dimer measures, simply put, it measures if you've got blood clots in your system, even if you may not see them or feel them. Elevated D-dimers means you may have had some blood clots, so you want to be aware of that, and because blood clots, lead to, you can die. I mean,
Right.
you can stroke
If they get in the wrong place.
Yeah, so you want to be aware if you've got blood clots, so you can dissolve the blood clots with blood thinners, and they're giving blood thinners to COVID patients in the hospital now, which is why we're seeing some improvement in the figures you mentioned in the beginning. That not so many people at the beginning, they were having some strokes and some troubles from blood clots. Now we're getting better at knowing that with the help of the D-dimer test, and we're giving blood thinners to prevent strokes and complications. So the numbers of deaths are not as steep as they once were.
All right, thank you for that tidbit about D-dimer tests. I glossed over that. And it's very important. It shows how we are improving in our treatment of COVID-19. We are now preventing clot-related illnesses and disasters from happening because we're measuring the D-dimer test. If you would like to schedule an appointment with Dr. Shoreman, he's in the LA area. You can email him at towergastro@gmail.com. And if you have a question for us, whether you're watching this after it's been live or we couldn't get to it, you can email us at myworldsciencetv@gmail.com. And we do this every Thursday about 3 p.m. Until next time, stay safe.